I'm very fond of the Crohn's and Colitis Foundation of Canada. I think that they have been unbelievably progressive, and I think the fact that you're having these weekly webinars is really one manifestation of that. As part of IOIBD, we recently had exchanged emails with some of the people that are on this webinar, including Mina, and they have been very proactive at trying to advocate for patients, even at the level of the healthcare system, to try to get the right medications for patients with IBD. So I'm very pleased to be asked to talk on this topic, even though, again, I feel a bit like a charlatan, since I think that all of Canada is well ahead of us in terms of healthcare system. And so, okay, so this is Miami Beach. Not that I would know, since the beaches have been closed until yesterday. And yesterday I was fit to be tied. I could hardly actually concentrate because I was dying to go to the beach. So, you know, I think Gil said this and Eric said this, that what COVID has done so many things. You know, it's an awful thing that so many people have passed away, but it also has allowed us to rethink almost every aspect of our lives, you know, our professional lives, but also our personal lives, and importantly in this context, how we take care of IBD patients. And I think it has to do with the obvious fact, which is this is when it happens, it can be lethal. It can be so random. You know, we look at age stratification, and everyone on this call seems extremely young, but no one is without the risk of dying. And so it really, especially in the early days when we didn't know exactly how we could control it, it was a very scary thing. And so I remember that actually one of the very last trips that I took was from, I'm in Miami, as I said, that was Miami Beach. At the airport in Miami, going to Los Angeles, I had to make this difficult decision of canceling our IOIBD meeting, which had been scheduled to occur later in March in Bordeaux, France. I know it's a tough job. But anyway, it was scheduled to happen, and I think that we decided, wow, there's just been a blip of cases in Paris. I wonder what's going to happen. So we had to predict what the future held, and we decided, okay, we're going to have to cancel the meeting. And then I went to LA, and while in LA, already all this COVID stuff was happening, and patients were worried. So a few of us, it was Corey Siegel and David Rubin, we got on a call to try to figure out what can IOIBD do to help during this situation. And I put up this sort of screenshot of the website. I also decided, well, since Gil had shown us a live website, I also will. And so this is our IOIBD website, very easy to remember, ioibd.org. And if you scroll down, you'll see that we have World IBD Day, and here we can link to some work that Gil Kaplan is leading within IOIBD. And we have all the guidance that IOIBD has tried to develop for patients and for physicians. It's been mostly targeted to physicians, but it's my feeling that if you have IBD, you can talk the talk and you know all about these things. So see, these are some of the links to recommendations on what happens in the acute care setting, like in the hospital, about clinical trials, about endoscopy and prioritizing endoscopy, infusion center guidance. I'm not going to talk very much about infusion centers, but at the very beginning, we asked ourselves, does it make sense for patients to come to our hospital-based facilities, or are they better off at home? And we ultimately decided that if they weren't already at home, that we couldn't control what was happening at home. If a visiting nurse was going there, and we could have better control of what was happening if the patients came to see us. Not saying that that was right, but that was the decision we made. And so, you know, COVID-19 really shook up how we deliver IBD care. And it was prompted, of course, by the desire and need to keep our patients safe and keep our staff safe. And we had to ask ourselves, do we really need to see every patient? Who really needs to come in to be seen? Who can have a virtual visit or skip a visit? How can we communicate adequately with so many patients and doctors that needed information? And that was a little bit of the inspiration for the IOIBD webinars and the IOIBD guidance. You know, gastroenterologists love doing colonoscopies. Most patients don't love having them done. But did everyone need a colonoscopy, or are there other ways that we could try to manage and figure out what's going on, right?